America is talking about weight loss again, but this time it's not just about diets or exercise fads. New drugs are shaking things up. These medications are creating a buzz from Main Street to Pennsylvania Avenue. In Washington, D.C., politicians are in a heated debate. The question is simple but important. Should the government help people pay for these potentially game-changing medications? The debate is about more than just dollars and cents. It's about healthcare, personal responsibility, and the role of government. It's about fairness and access for all Americans. The new wave of weight loss drugs called GLP-1s are making headlines. Unlike older diet pills, these medications work differently. They mimic a hormone that helps us feel full and control blood sugar. This means people eat less and lose weight more effectively. Some even see it as a breakthrough for obesity, a serious health concern affecting millions. The demand for these drugs is skyrocketing. People are tired of struggling with their weight. They see these medications as a new hope for a healthier life. But there's a catch. These new drugs come with a hefty price tag. All eyes are on President Trump and his administration. They face a critical decision. Should Medicare, the government's health insurance for seniors, cover these pricey weight loss medications? It's a tough call. On one hand, there's the potential to improve the health of millions and save money on obesity-related diseases in the long run. On the other hand, the cost of covering these drugs for millions of Americans could put a significant strain on Medicare's budget. It's a classic dilemma balancing costs and care. This debate has another layer, a clash of titans in the healthcare industry. Big pharmaceutical companies, the makers of these brand-name GLP-1 drugs, are pushing for Medicare coverage. It's a lucrative opportunity for them, but they're facing competition from a new player, telehealth companies. These telehealth companies offer a cheaper, alternative compounded versions of GLP-1 drugs. They argue that their services make these medications accessible to more people who can't afford the brand names. It's a classic David versus Goliath story with patients caught in the middle. At the heart of this debate lies a fundamental question. Should the government, through Medicare, pay for weight loss drugs? There's no easy answer. Those who support coverage argue that obesity is a disease, not a choice. They believe everyone deserves access to treatments, regardless of their income. Opponents argue that covering these expensive medications will strain Medicare's resources and could lead to higher premiums for everyone. It's a complex issue with no simple solutions. The debate intensified when shortages of brand-name GLP-1 drugs hit the market. People desperate for these medications turned to compounded versions offered by telehealth companies. These compounded drugs, often cheaper, provided a lifeline for some. However, this sparked a new battle. Big Pharma cried foul, raising concerns about the safety and effectiveness of compounded drugs. They argue that these versions lack the rigorous testing and regulation of their brand-name counterparts. The telehealth companies counter that they're providing a vital service, making these life-changing medications accessible to those who need them most. As with any hot-button issue in Washington, there's a frenzy of lobbying activity. Big Pharma is flexing its considerable muscle, pouring millions into lobbying efforts to sway lawmakers and the Trump administration. They argue that their medications are not just about weight loss, they're about improving overall health and reducing the burden of chronic diseases. Telehealth companies, though smaller, are not backing down. They're highlighting the stories of everyday Americans who rely on their affordable compounded medications. Both sides are using their resources to influence the decision makers, making this a high-stakes battle in the corridors of power. Amid the debate over drug costs and access, some voices are calling for a focus on the fundamentals: diet and exercise. They argue that while these new medications can be helpful tools, they shouldn't overshadow the importance of a healthy lifestyle. They emphasize that true well-being comes from a holistic approach, including regular physical activity, a balanced diet, and mental wellness. While these lifestyle changes require effort and discipline, they argue that the long-term benefits far outweigh any quick fix offered by medication alone. The debate raging in Washington over weight loss drugs is about more than just pills and profits. It's about the future of healthcare in America. It's about affordability, access, and the role of government in our lives. The decisions made today will have a ripple effect for years to come. They will determine who gets access to these potentially life-changing medications, how much they will cost, and whether we prioritize prevention or treatment. Ultimately, it's a debate about our values and priorities as a nation.